Yes, I'd like to introduce you to the history of medicine in Pictou County, Nova Scotia. It covers a 200-year period, and it's sponsored by the Medical History Society in Nova Scotia, which is funded by three organizations. You'll notice on the screen College of Physicians and Surgeons, Doctors Nova Scotia, and the Faculty of Medicine at Dalhousie University. So this is one of our presentations. We have approximately 15 presentations that we've made, and we give these presentations around the province. Now, these have to do with medical history, and when you think of medical history, you're asking questions such as, who were the medical practitioners in, say, Pictou County, which is a presentation's about? And then there's a number of other questions that you'll see on the screen that are typical of what people want to know about. Now, when we think of Pictou, Pictou was first settled in 1767, and on the ship that came to Pictou from Philadelphia, there was a doctor, the first doctor in Pictou County, and he had trained under the apprenticeship program, because there were no schools of medicine in Canada or United States at the time. He was followed by a number of other medical practitioners, mainly from Scotland, as you'll see here. They did their degree at Edinburgh, and they came into Pictou during the first years of the 19th century. One of the first to come in at that time was a Dr. Alexander Forrest, who came in 1832 to New Glasgow. He practiced there for many years and then went to Lunenburg and then finally to Halifax. Fortunately, his day books exist and are at the Nova Scotia Archives. A second doctor to come in at that time was Dr. Murray, born at Barnish River. A lot of these doctors taught school before they became a doctor. He then did his degree in Pennsylvania, opened a drugstore, and practiced mainly eye operations. Now, when we think of medicine at that time, there were two types of medicine. One was allopathic, the other was alternative. The allopathic means that all diseases were treated the same way, with mercury cathartics, emetics, diuretics, and bloodletting. At that time, there were very few methods by which you could diagnose a patient. The stethoscope had been invented in 1816, but very, very few doctors used it until the 1840s. The microscope in 1830, the ophthalmoscope not until the 1850s. The whole idea that there was such a thing as bacteria didn't start to become known about until 1867 through the work of Louis Pasteur. And then Dr. Joseph Lister in Scotland took Pasteur's ideas and decided to try to apply them in surgery to try to prevent infection. Now, there are many, many infectious diseases, as you know, and that was a real problem during the 19th century. Cholera, consumption, diphtheria, scarlet fever, typhoid fever, whooping cough, and a lot of those were not, there was no cure for them whatsoever. There were also viral diseases, measles, and smallpox and yellow fever. Yellow fever didn't bother us here, but a lot of people came up from the Caribbean with yellow fever and they had to be treated. Some more modern doctors, Dr. Johnston, who was in Stellarton for 40 years, he was born in Wolfville, a graduate of Pennsylvania, practiced in Bridgetown, and also practiced in Stellarton. He was one of the original medical staff of the Aberdeen Hospital. This next man, Dr. George Cox, very, very important man in the history of medicine because he was very, very much involved in trying to prevent and cure TB, which at that time was called consumption. He graduated from New York. He did studies at Eye and Ear Clinic in New York. And this is the book that he wrote along with another person. And they were trying to convince people in Nova Scotia that they had to do something to prevent consumption or tuberculosis. They had what were known as anti-tuberculation leagues. Tuberculosis was the most common cause of death in Nova Scotia at the time. Dr. Douglas is one of the more modern surgeons in Pictou County, graduated from Dalhousie. Joined the Aberdeen Hospital in 1939, as a lot of doctors at that time joined up during World War II, as Dr. Douglas did. Now, one of the very important things in medicine, of course, in the history of medicine, are hospitals. It took a long time in Nova Scotia before hospitals were established. The first one being a marine hospital in Pictou in 1873. There were also requirements for poorhouses. And within the poorhouse, there was a hospital usually. Here we have the first marine hospital in Nova Scotia at Pictou, established by the federal government. The idea was to provide a hospital for mariners and seamen and a quarantine station. Then we have the poorhouse and asylum, which every county had a poorhouse and asylum for mental patients and for paupers, people who couldn't look after themselves at all economically. So here we have the Pictou County Poorhouse, 1890, had 89 inmates. The first public hospital in Pictou County was the Pictou Cottage Hospital, which was just a house. Most cottage hospitals were simply a house. It had 8 beds, but it was established in 1893 by the citizens of Pictou, as well as Dr. John Stewart, who had been a student of Lord Lister. Here's a picture of Lord Lister's students in Edinburgh, and John Stewart was a second-year medical student there. He's the gentleman on the back row, the third from the left. And he was from Pictou County, and he's very important in the history of medicine in Nova Scotia. He became Dean of Medicine at Dalhousie. While he was with Lister in Edinburgh, Lister had invented carbolic acid spray to prevent infection of wounds during operations or after operations. This is the carbolic acid spray device which he gave to his student, John Stewart, and which we now have in our collection. The Aberdeen Hospital was one of the first hospitals in Pictou County as well, 1897, established by the citizens of the 4 towns. The 4 towns now never agree on anything, apparently, but they did in 1897 and established this 18-bed hospital. 1950, we have the medical staff at this Aberdeen Hospital, and the first 3 gentlemen on the front, elderly men, they were very involved in dealing with the Halifax explosion. What happened was a lot of people from Halifax who were injured were sent to a hospital in New Glasgow because all the hospitals here in Halifax were filled. TB was rampant all over Nova Scotia, so the Sisters of Charity from Halifax established a hospital, a sanatorium actually, in Stellarton to treat people in Pictou County with tuberculosis. And it eventually closed, but it was very, very important at the time. Pictou also created another hospital, larger hospital, in 1928 with 22 beds, and here it is in this image, and it eventually got even larger. Here are some of the nurses at that hospital. You'll notice they're dressed quite differently than nurses are today. That's the story on Pictou County medicine. Thank you.